spans from a little girl at birth, to puberty, to adolescence, to womanhood, to reproduction, and then to menopause and the postmenopausal phase of her life. Today I shall be discussing with you about a pertinent issue of menopause. The word menopause brings in mixed emotions. Emotions of despair, disappointment, depression, anxiety, to pessimism and for some, freedom from the monthly cycles. However, the switch of menopause is really difficult to combat, and with it come questions. But is menopause really that worse? Is my question and your question. So ladies, we need to make the menopause switch. We need to deal with menopause with a positive attitude. We need to devise a menopause plan. After menopause, your hormones have got out of control, they are haywire. How to get it balanced? Ladies, no sweat, it's just menopause. So the first step in the management of menopause is lifestyle modification. And none but you can help yourself with these lifestyle tips. The first tip is don't take stress about menopause. In case you are stressed, combat the stress. Meditation for menopause relief, guided meditation for anxiety, yoga exercises, and breathe away your stress. Involve your family, take family support. Menopause and fitness go hand in hand. Reasons: 1 in every 3 women has a heart problem after menopause, and 20% of your bone calcium simply dissolves out of your body in the first 5 years after menopause. So exercise is a must. But certain prerequisites before that: quit smoking, limit your alcohol intake to 2 to 3 times in a week, don't just sit around and be sedentary. Have a well-balanced, nutritious diet with fruits and vegetables. Add calcium and vitamin D to your meals. So what kind of exercise do we have to do? Low-impact exercise like swimming, cycling, biking, motorcycle, yoga, Pilates, Zumba. Do aerobic exercises, weight-bearing exercises, stretching exercises, strength building exercises. The question now is what not to do so that if we have osteoporosis and brittle bones, we don't break our bones. Don't do high impact exercise. Don't do too much of bending and twisting around, and make sure that you're avoiding certain moves in yoga, Zumba and Pilates. So while we fight the middle age spread, the belly fat, are exercising regularly, trying to lose the excess weight, there is a role of diet in menopause. Menopausal supplements are of importance. But before that, we must know what not to eat. Avoid sweets, stimulants, fatty foods and spicy foods. And of course, reduce your caffeine intake. Amongst the diet supplements, 3 supplements are of utmost importance: food rich in calcium, food rich in vitamin D, and food rich in estrogen. To the surprise of many, these estrogens are found even in plants and therefore are known as phytoestrogens. Phytoestrogens contain isoflavone, which is chemically very similar to that of estrogen. This is commercially available in the form of tablets, which are isoflavone supplements. But we must understand from where you and I at home as a home remedy can supplement ourselves with these plant-based estrogens. Most importantly, the highest source is soy-based products. Soy or soya, whatever you may like to call it. Soy is available as soya bean, edamame, soy flour, soy powder, soy nuggets, and of course tofu. Whole grains like oats, millets, bajra, and nuts like cashew, walnut, flax seeds, besides vegetables like broccoli and cabbage, and fruits like apple, strawberries, kiwi, apricots are rich in plant-based estrogens. Notwithstanding that, there are certain food items which are nutritive and help to boost the estrogen intake, like vitamin A, C, E. Omega-3 fatty acids and magnesium help to provide vaginal dryness treatment along with garlic. There is another subset which is about estrogen-based herbal supplements which include ginkgo and red clover available commercially. Calcium, as we all know, is necessary for our bones. Milk is a rich source of calcium, and of course all the milk products like yogurt, cheese. Soy milk of course cannot be discounted. Besides that, there is garden peas. Vegetables like broccoli and cabbage are rich in calcium too, and seeds like sesame seeds and flax seeds are also high in nutrition for calcium. Dried figs, apricots are yet another source. Fish like salmon and sardine is also rich in calcium. Vitamin D of course comes from egg, sunshine and certain mushrooms. And now we need to combat the hot flashes. Make sure that the ambient temperature of the room is low. You have a portable fan by your bedside. You wear light cotton clothing. Especially your nightgown should be of cotton and not of synthetic material which does not have breathable fiber. Keep an ice pack or a cold pack below your neck or under the pillow just in case it gets very hot. Wear dresses and clothes which are in layers so that the moment you feel hot you can keep removing one layer after another. And make sure that the food that you eat is rich in estrogens, that is plant-based products. Omega-3 fatty acids and magnesium do help in hot flash treatment. Complementary alternative medicine therapies like acupressure, acupuncture, de-stress therapies work wonders as well. Positive sexual health and sexual well-being cannot be discounted. Do involve your partner. About 45% of the women post-menopause do experience pain during sexual intercourse. Contact your gynecologist. She may give you certain lubricants and creams to apply, which could be estrogen based for enhancing the vascularity and the blood supply and thereby increasing the lubrication, or she may give you plant-based, organic, chemical-free treatments as tubes. There may be ordinary lubricants itself which could be used. Do use aromatherapy and essential oils because they act as sexual stimulants to your sexual drive which may have gone down. Essential oils like lavender, ginseng can be used. Alongside, there are certain herbal supplements like ginkgo biloba, chasteberry, which can be used. Some women do experience incontinence of urine, that is stress-based incontinence, that is the urine leaks when they cough, sneeze. This can be managed by doing ongoing regular pelvic floor exercises, predominantly the Kegel exercises, wherein you are asked to tighten your urethral orifice from where you pass urine and tighten the anal orifice from where you are passing stool regularly on an ongoing basis, and this will help treat by doing exercise methodology. Alongside, you may even go to your doctor because like the vagina dries out and becomes atrophic, the urine sphincter can also become atrophic. Certain creams can be applied and there can be a methodology by which burning in urine can be experienced by some. It is so similar to the vagina drying up, the urine passing urethra orifice also dries up, and certain cream supplements are given for that as well to restore back the youth and the blood supply to that area. Skin for sure will be affected. There will be wrinkling, there will be sagging of skin. We can do face massage, we can apply vitamin C, vitamin E creams, and also take supplements for retaining the glow of the skin. But when it comes to acne, which happens at the time of menopause, you may need to consult your dermatologist. The reason being that the androgen male hormone levels have gone up and the estrogen has come down, which is causing a flare. But what is in your hand is not to stress, because acne can increase because of stress, because the stress itself increases the male hormones. Besides, please avoid harsh face washes. Coming to your beautiful mane, that is the hair. There is hair loss for sure. but it can be a foot in the mouth kind of situation. The stress that you are taking because you've had menopause can accelerate the hair fall, which is going to happen naturally because of the hormonal imbalance. The remedies that you can do for yourself is to provide yourself with good balanced nutrition, take hair supplements, massage your scalp gently, make sure that you have enough hydration, avoid harsh chemicals and dyes, use natural products, make sure that you don't tie your hair very tight into a ponytail. They say that your health is reflected by your hair and nails both. Your weak, brittle nails, which might happen during menopause, need to be taken care of and pampered. You can do home remedies like an oil massage of olive oil or coconut rub. Soak your nails in sea salt water. Take cuticle care. Eat a well-balanced diet. Take nail supplements. Protect your hands and nails by wearing gloves. If you have an anxiety problem, please don't suffer in silence. Exercise, recreate yourself and sleep well. In case you have depression, share with your family members, consult a psychologist or a psychiatrist, go for your therapy and counseling sessions, find an activity which interests you, follow your passion, find a hobby and take it to your heart. The buzzword in the field of menopause is HRT, hormone replacement therapy. There have been many studies, but the question here is, who are the people who will benefit from it? What are the indications? What is the usage regime? And what would be the possible risks and side effects? So there are two kinds of menopause. A natural menopause in which the uterus and the ovaries are very well inside your body, and the other is a surgical menopause in which either both the ovaries have been removed or the ovaries along with the uterus has been removed, that is hysterectomy with oophorectomy. Bilateral. So obviously, if a young menstruating woman or a woman who has not yet achieved menopause, her ovaries are removed with or without the uterus, the surgical menopause that happens can be really troublesome. So the indications for using HRT are for those patients who undergo a surgical menopause and for those who are really troubled by the vasomotor symptoms, that is hot flashes, night sweats, and those who have other problems like mood swings, low sex drive, difficulty in concentrating and vaginal dryness, and have already used the other forms, that is the complementary alternative medicine forms like the plant-based estrogens and other supplements, but it has not worked wonders for them. The other subset for whom HRT can be used is to prevent the bone loss, particularly in those who undergo premature menopause, that is menopause before the age of 40 years because of premature ovarian failure. The question now that arises is, who is not to be given the HRT? Those people who are at risk of clots, thromboembolism, who have a history of breast cancer, uterus cancer, ovarian cancer, have allergies to estrogens, progesterones as hormones, are the people not to receive HRT. The question then arises is that in case we give HRT, can there be side effects? Yes, if we give HRT to a woman who has a uterus, she can have a higher chance of developing uterus cancer in the form of the lining of the uterus cancer called endometrial cancer. There is higher risk of breast cancer, ovarian cancer. There is higher risk of heart disease, strokes, thromboembolism and clots. There is higher risk of developing gallstones, and there is also a risk of mental decline. So the question is, what are the forms in which these HRTs are given? You could get it in the form of tablets, that is in the form of pills, or in the form of creams, gels, patches, sprays and even implants. We can even use these HRT in the form of vaginal tablets, suppository, rings and creams. The hormones which are used are but obvious: the female hormone estrogen and progesterone, and sometimes even testosterone, which is the male hormone. The question that often arises is that I am the right candidate for HRT, then in what form would a pill-based HRT be given to me? It can be given like any other contraceptive pill, which can be in the form of a cyclical methodology, that is, every month you take it, you stop it, you will get a bleed, again you take it, you stop it, you get a bleed, or it can be taken continuously for a few months without any break. The minor side effects which can happen because of the estrogen or the estrogen and progesterone combination HRT can be fatigue, tiredness, abdominal bloating, indigestion, joint pains, breast tenderness, hair loss, and so on and so forth. Sometimes it can also lead to dizziness, nausea, and irregular vaginal bleeding. Let me add that to one of the list of the contraindications for HRT is an unexplained vaginal bleed. Newer drugs like Tibolol are way safer as an alternative to the conventional hormone-based HRT. The journey of a woman, a mother, a daughter, wife, girlfriend, sister, and many more roles. A health information show from a women's health perspective, hosted by me, your very own gynecologist, Dr. Puja Dewan.